Hello doctor and friends, thanks for joining with us. We are from SGDB6. We'll present our student project entitled Extrapyramidal Syndrome. My name is Vinny Fernando Valentin with student number 086. Here is our agenda today. As we all know, the benefit that neuroleptic medication provide in treating psychotic symptomatology in schizophrenia are well established. In addition, neuroleptic medication are often used to treat acute psychotic episodes that are not related to schizophrenia. Neuroleptic medication are also often used for their acute sedative properties in treating agitated patients, both in psychiatric and non-psychiatric settings. In tandems, with the benefit of neuroleptic medication are significantly risks associated with their use. These risks are primarily acute and chronic neurological adverse effects involving voluntary and involuntary musculature.
My name is Aristan, student number 237. The student project focused primarily in acute side effect of neuroleptics, generally referred as extrapyramidal syndrome or EPS. The most common adverse drug effects patients experience from dopamine receptor blocking agents. A variety of movement phenotype has been described along with EPS spectrum, including dystonia, akathisia, and Parkinsonism, which occur more acutely, as well as more chronic manifestation of tardive akathisia and tardive dyskinesia. These side effects are more often or resulting in presentation of psychiatric emergency service.
And here our purpose of making this children project is the importance to understand the description, symptoms, risk factors, pathophysiology, the medication that induce EPS, and what we should do to prevent and cure extrapyramidal syndrome.
The benefits of this student project is by understanding the description, symptoms, risk factor, pathophysiology, medication side effect, preventive way, and curative way of extrapyramidal syndromes so that the clinician can make the best choice when designing the drug for critically ill patients, especially neurobehavioral disorder patients.
Hello, my name is Shanti Dewi with my student number 142, and today I will tell you about the general information of the extrapyramidal syndrome. So, the extrapyramidal syndrome, also known as extrapyramidal symptoms or extrapyramidal side effects, is a series of serious adverse side effects which affects movement. These side effects could occur when the antipsychotics dopamine receptor blocking agents or DRBAs are being processed in the body. The symptoms could result in various acute long-term movement disorders such as the tremor, muscle rigidity, auto restlessness, slow movement, etc. If these symptoms last for a long time, they might damage one's quality of life because of motor impairments. It is also one of the main reasons why schizophrenic patients stop their antipsychotic treatment, so they must opt for a different alternative treatment.
My name is Tiara with student number 105. So the symptoms of EPS can be categorized into early and delayed symptoms. The first symptom is akathisia. It occurs in 1 to 40% of the patients and causes the patients to be restless and tense and causes them to do uncontrollable movements such as fidgeting or tense during standing still. The second symptom is acute dystonia, affecting 25 to 40% of the patient and cause the patient to experience muscle stiffening and repetitive involuntary muscle contractions, such as spasm, blinking, tongue protrusion, and would lead to abnormal posture. The third is Parkinsonism. It occurs in 20 to 40% of the patient. This symptom resembles Parkinson's disease, such as rigid muscle and gait walking. Besides from the common symptoms, there are also rare symptoms. One of them is neuroleptic malignant syndrome, or NMS. It occurs in only 0.02%. However, this is very serious as it could lead to coma and even death. Last is tardive dyskinesia, which is a delayed symptom and causes involuntarily movement, such as chewing and lip smacking without the patient realizing.
Good afternoon everyone, my name is Dia Iswitari, student number 173. Moving on to what causes extrapyramidal symptoms. Before that, we have to know that the extrapyramidal systems consist of multisynaptic neurons, the forebrain, and the basal ganglia, which are responsible for involuntary movements. The damage to the structures in the basal ganglia, either from trauma or disease, can result in someone having extrapyramidal symptoms. However, the majority of EPS are caused by side effects of dopamine receptors blocking agents known as the RBAs, also called antipsychotics. Patients with the first episode of psychosis have a higher chance of experiencing EPS from the RBAs than chronic users. Conventional or typical antipsychotics, such as haloperidol, are said to have higher tendencies to cause EPS on patients due to their strong dopamine blocking effects and lack of serotonin signaling than atypical ones.
Hello, Doctor and friends. My name is Udayana, student number 165. I will continue to explain about the causatives of EPS. Neuroleptic agents are known to bind with and block dopaminergic receptors in the forebrain and basal ganglia. The antagonistic binding of dopaminergic D2 receptors within the mesolimbic and mesocortical pathways of the brain and anti-dopaminergic action in the caudate nucleus and other basal ganglia may contribute significantly to the occurrence of EPS. Changes in muscle tone and normal passive resistance, abnormal involuntary movements, poverty or excess of movement, alteration of various autonomic movements, alteration in affect, and cognitive changes can be caused by dopamine reduction. In general, the risk factors of EPS are children and elderly, which are in the highest risk of all, the prolonged use of higher potency antipsychotic, exposure to electroconvulsive therapy, and a diagnosis of organic brain disorder. Thank you.
Okay, good afternoon, doctor. My name is Ardhigita Pramesti, student number 044. Now I'm going to talk about the pathophysiology. As we all know that antipsychotic medications are generally used to reduce the symptoms of psychosis such as hallucinations and delusions. And all of these drugs are antagonists of D2 receptors. It produces their therapeutic effect by binding D2 receptor in the terminal end of the ventral tegmental area. But unfortunately, this kind of drugs also cause unwanted side effects. And one of the side effects is extrapyramidal syndrome. And this syndrome is commonly caused by the first generation of antipsychotic, or also known as typical antipsychotic.
My name is Cekode Terapianti Pemayun with student number 252. These antipsychotic drugs are unfortunately unable to bind dopaminergic neurons in the brain region selectively. Extrapyramidal syndrome, or EPS, occurs also due to the imbalance between dopaminergic and cholinergic neurotransmission activity. So there's a predominance of cholinergic activity over dopaminergic activity, which is caused by inhibition of D2 receptor in the nigrostriatal pathway. EPS is treated with anticholinergic drugs, which can counteract the imbalance between dopaminergic and cholinergic neurotransmission in the extrapyramidal system. Thank you. Next.
Hello, my name is Rismadania, student number 195. So I will explain about drugs that can cause extrapyramidal syndrome. Extrapyramidal syndrome, or EPS, can occur in both adults and children and may be severe. EPS symptoms may begin early after we start a medication. These kind of symptoms are debilitating and interfering with social functioning and communication. The most common medication associated with EPS are the first generation antipsychotics such as haloperidol, fluphenazine, and chlorpromazine, which acting in central as dopamine receptor blocking agents. And all of these drugs also have side effects. The first one is haloperidol. This can make muscle stiffness and Parkinsonism. And the second one is fluphenazine. This can make sedation, dry mouth, and constipation. The third one is chlorpromazine. This can make dizziness and shuffling walk. Thank you.
Hello, doctor and friends. My name is Aswatasha, student number 224, and I will explain other drugs that can cause extrapyramidal syndrome. Now, there are perfenazine, risperidone, quetiapine, and ziprasidone. Now, perfenazine is an antipsychotic drug. When used in level greater than 1.2 mg per milli, can cause and increase the risk of having extrapyramidal syndrome as its side effect. And risperidone is a second-generation antipsychotic drug, but when it dissociates from its receptor and has loose binding to the D2 receptor, it will increase the risk of having extrapyramidal syndrome. Now, quetiapine is an atypical antipsychotic drug. It is associated with EPS and placebo, but has low risk when administered to elderly, adolescent, and patient with chronic brain disorder. And ziprasidone is believed to be able to cause EPS. While it is actually very good to treat schizophrenia and bipolar disorder, it does not have risk of causing EPS, or it is low risk. Thank you.
Student number 018. The main purpose of the treatment of EPS is usually to lift the patient's quality of life, for example, decreasing pain or discomfort. Acute extrapyramidal symptoms can usually be resolved easily through several mechanisms. First, dose reduction of the neuroleptic. Second, switching from typical antipsychotics to atypical antipsychotics. In the case of pharmacotherapy, medication is used to reverse the EPS by inhibiting dopaminergic neurotransmission. The drugs given will vary depending on the type of the EPS. Next. A patient experiencing acute dystonia must be assessed to see if they need any emergency airway intervention, as laryngeal and pharyngeal dystonia may increase the risk of respiratory arrest. Acute dystonia may be reversed by administration of oral anticholinergic medications. 2 to 8 milligrams of 3-hexyphenidyl per day and the same dose of benztropine are the most common medications given. However, if the symptoms are severe, antimuscarinic agents or diphenhydramine should be administered by intramuscular injection. If anticholinergics are ineffective, then intravenous benzodiazepine may be used instead. Next. In cases of tardive dystonia, additional treatment involving benzodiazepine, botulinum toxin injection for facial dystonia, muscle relaxant like baclofen, and dopamine-depleting agents such as tetrabenazines may be considered. Next. Some second-generation antipsychotics such as lurasidone are more likely to cause akathisia compared to others. The first approach should be to switch to another antipsychotics with a lower risk. Second is the administration of antimuscarinic agents. Treatments that are specifically used for akathisia include the administration of clonidine, mirtazapine, beta blockers like propanolol, and even benzodiazepines. Anticholinergics, however, are not usually able to relieve akathisia. Next.
My name is Jennifer Jasuna Gunawan with student number 068. Treatment of tardive dyskinesia includes dose reduction or withdrawal of the causative medication, switching to a typical antipsychotic drug, withdrawal of concurrent antimuscarinic medications, and injection of botulinum toxin for facial dyskinesia. Several trials have also reported therapeutic effect of levetiracetam, zonisamide, pregabalin, vitamin B6, and vitamin E towards tardive dyskinesia. Drug treatments include administration of dopamine-depleting agents such as razorpine and tetrabenazine, benzodiazepines such as clonazepam, GABA-mimetic drugs such as sodium valproate and baclofen, low doses of dopamine agents, and monoamine transporter 2 inhibitors such as valbenazine. Treatment of Parkinsonism includes administering medications used to treat Parkinson's disease such as amantadine, antimuscarinic agents, dopamine agonists, and levodopa, reducing the dose of causative medication, and switching medication to a typical antipsychotic. These are several drugs that are used to treat EPS based on its symptoms. It includes the dosage, contraindication, special precaution, and adverse reaction.
Good afternoon, doctor and friends. My name is Vanessa L, student number 121. Now I will conclude our student project in a few sentences. Neuroleptic medications could be used to treat psychotic symptoms in schizophrenia. EPS is a bunch of acute adverse side effects from the schizophrenia's medications. These side effects could happen when the dopamine receptor blocking agents or DRBAs are being processed in the body. The first symptoms of EPS is akathisia, the second symptom is acute dystonia, the third symptom is Parkinsonism, and there are also some rare symptoms, for example, tardive dyskinesia and neuroleptic malignant syndrome. New users of the DRBA's treatment have a high chance of experiencing EPS, so it is important to give low doses and slowly increase the dosage. First-generation antipsychotics like haloperidol and flufenazine are the most common medications that have EPS as one of their side effects. Haloperidol could block D2 dopaminergic receptor and serotonergic 5-HT2A receptors, while flufenazine acts primarily as antagonist of postsynaptic D2 receptors. Mild to moderate acute dystonia may be reversed by taking anticholinergic oral medications, while akathisia is still on trials. Tardive dyskinesia could be treated by reducing causative medication and switching to atypical medications, while Parkinsonism could use medications such as amantadine, antimuscarinic agent, dopamine agonist, levodopa, reducing causative medication dose, and switching medication to atypical antipsychotics. Here are our references that we use in our student project. And that's all for our presentation. Thank you and hope you enjoy our student project.